Hi there. My name is Jennifer Harrison, and I'm really pleased to be an associate professor and the interim director at Western Michigan University's School of Social Work. And I want to talk to you a little bit today about my research, teaching, and service agenda as a member of the faculty in the School of Social Work, and in ways that can help you to understand it better and also offer opportunities to share or collaborate on that research agenda. So most of my research is focused on evidence-based practice implementation in behavioral health. So I'm very focused on working with families and adults with co-occurring mental health conditions, as well as substance use disorders, and also how do evidence-based practices get implemented? So how do we understand them? How do we implement them to high fidelity? How do we measure the outcomes related to recovery indices like employment, housing, lower rates of incarceration and hospitalization, and improved health, as well as social inclusion within our communities. Finally, I'm interested in the integration of peers, recovery coaches, or people with lived experience within those behavioral health evidence-based practices. The second stream of research that I'm studying is how to provide workforce education and training to the behavioral health workforce, including the integration of digital tools, including one that I developed with a colleague, Dr. Chapleau, as well as a colleague, Dr. Bridget Weller, using that we call Goal Scaling Solutions, which provides a digital platform for providers to be able to communicate with clients or teachers with students about individualized goals and measure small but meaningful incremental change toward those goals in pursuing recovery, educational goals, or knowledge translation following training. A third area of research that I'm focused on is the interprofessional implementation of international and study abroad courses, specifically those related to social justice and how those impact students over time and their practice, whether in social work or other associated health fields, as well as in areas including business and nonprofit leadership. My teaching is focused on primarily on field education, which is the signature pedagogy of social work education, as well as study abroad and trauma studies involved in clinical practice. I teach a course on trauma and military and veterans within our trauma specialization, as well as two courses that are study abroad courses, one in Guatemala that's focused on community health and permaculture, and a second one that's in India that's focused on social justice and sustainability. Those two courses are both interprofessional, short-term faculty-led study abroad courses, which means that they travel either over the spring break or in between semesters that allows for a 10 to 14 day study abroad experience that doesn't get in the way of other courses or the field experience for the students that I get the privilege to work with. My service is primarily related to direct service for adults and families with co-occurring mental health and substance use disorder conditions, as well as services in school systems and in nonprofit organizations that support our local organizations. So I serve on several boards, including as the past president of the Martin Public Schools Board of Education. I'm currently the president of Transformational Connections of Southwest Michigan, a small nonprofit organization that does work with partners in Guatemala, and also serve nationally with some SAMHSA expert panels, as well as on the American Society for Addiction Medicine on the implementation of employment services for people with substance use disorders, as well as services for adults with opioid use disorders and co-occurring serious mental illness. So thanks so much for allowing me to introduce myself. I'm excited for the opportunity to work with some of you as colleagues, as students, as alumni, and thanks for being a part of Western Michigan University's School of Social Work.